Kat. I'm a student nurse midwife from Emory.
And I'm Courtney. I'm a student nurse midwife from Vanderbilt.
And we're here to show you some labor support tips today. They're really great for patients who do not have an epidural, but some of them also work for epiduralized patients as well. So we'll show you some of those tricks.
So our first tool is going to be the birth stool. So I'm going to have Kat be our patient. So there are lots of ways you can use this birth stool. Classic, sit on the front, squatting. This is great. You can have a partner either behind, providing support, or a partner come in front and provide support this way. Okay. You can also do standing lunges on this. This is great for a patient that's really mobile. You can do side lunges or front lunges. Another great use for this is we can put this up on the bed and we can use it for kneeling. See kind of this on the front. This provides the patient a really good way to lean, give them a little extra support aside from the top of the bed. So something that's really great for our epidural patients, we can have them do what we call froggy. That way, this opens up the pelvis, but also lets them kind of lay back and relax. So you can also use this side lying, kind of like a peanut ball. You can use the birth stool to provide a little extra support for your leg. So our last use for our birth stool would be sitting in the shower.
So it's waterproof, so you can just put it right there in the shower and let her sit how she wants.
Absolutely.
All right, so we're gonna move on to the birth ball or the yoga ball, which a lot of people are familiar with. So your patient can sit down here, and if she feels like she needs a little extra support, someone can be behind her. She can bounce like this or rock her hips side to side. This is also a nice place where your support person can either give some pressure right on the sacrum or squeeze the hips in a nice hip compression here. Or if she likes, you can even give her a nice little upper back massage. She can also turn and face the bed when she's on the ball. So she can put her hands on the bed for support. She can also bring the ball up into bed with her. And kind of use the ball to rock back and forth. Again, you have access to her back here if you want to give her pressure anywhere, or put warm washcloths on the back, or give her that nice back massage again. So that's your beautiful birth ball. And then we have the peanut ball, which a lot of people are familiar with. The peanut ball is a really nice way to help your patient get some rest while opening the pelvis and helping bring baby down. What you really want to get with the peanut ball is make sure this bottom leg is straight, and then this top leg comes as far over as possible. So you can see her top leg really has like 2 right angles in it, and that's really going to get her hips open so she can hang out on this side for 30 minutes and then flop to her other side for another 30 minutes and then keep flopping back and forth. And again, this is a really good tool for an epiduralized patient. All right. So now we'll show you some moves from spinning babies. Spinning babies is a technique used to align babies really nicely in the pelvis, and it helps birth go quicker and gets babies really properly aligned so that pushing stage isn't quite so arduous. So we'll start with a side, we'll start with this beautiful thing. That's fine. So this is called shaking the apple tree. So you can get just a towel and you drape it over her hips. And this is really nice for someone who's having back labor or any type of back pain. And as she's in all fours, you grasp your towel and you're shaking her hips side to side. And you can see you're really shaking like her whole abdomen, and this can give her some really nice relief. You can also help baby who's really high in the pelvis kind of lift itself up and get in the pelvis by taking this towel underneath her belly and doing the same thing. You gently pull up on the towel, so you're kind of cradling her belly, and give her a nice shake here. Some people like the way it feels through a contraction. A lot of people don't like to be touched during a contraction, so just ask your patient what feels better for them. We will also show you Yep, hands and knees position. So this is also really good for someone who's having back labor. If labor's been going on for a really long time and it seems like baby is maybe malpositioned, you can help her get in this position for 10 or 15 minutes. So baby comes out of the pelvis, and then when she sits back up, you can give her some help. Hopefully baby has space to drop back down in a better position. All right, our next spinning babies is sideline release, which is similar to the peanut ball. You want her as close to the edge of the bed as possible. Yeah, scoot even more, Courtney, with your, yeah. And your top leg is dangling off the bed. So it's not supported, so she might kind of feel like she's falling off the edge of the world. So you need to stand here with her, maybe give her some support on the shoulders and hips. And what this is doing is relaxing the pelvic floor, so baby can snuggle his head down in there and get in that really nice position. Ideally, you want her to stay here through 4 or 5 contractions. It's probably going to be very uncomfortable for her, so just reassure her that you're here, she's not going to fall off, and she's safe. And then you flip and do 4 or 5 contractions on the other side as well. Our last spinning babies move is a standing maneuver. During a contraction, mom is going to tuck her pelvis and hold onto her belly and kind of lift it up. And then her support person, which is either you, her nurse, or maybe her spouse or her mom, can stand behind her and help lift that tummy. And she can also kind of give her weight to that support person. So during each contraction, she bends the knees a little, tucks her belly, and you can support her like this. You can stand up, Courtney. So again, this is for a baby who's not really well engaged in the pelvis. And hopefully by tipping baby up, you help get them in a place where they can align themselves correctly.
Okay. So our last support thing would be the birth bar, squat bar. So we're gonna kind of demonstrate for you guys how we get this put on.
And we have holes like this on each side of the bed. And that's where this squat bar fits into. Got it?
Yeah.
Okay.
Okay, so Kat's gonna be our patient again. So there are lots of different positions you can use with the squat bar. We have our classic squat. This gives them a little more support. They have something to hold on to while they're squatting. They can also lean forward on this. Just a different support. So for your epidural patients, this can also be really helpful. Have them lay on their backs. The squat bar can be used as foot support. Another really great thing you can do with the squat bar is tug of war. Just get your sheet on here and those ends. They can use this to kind of help pull themselves up, crawl around baby. Also for your squatting patients, they can use tug of war to help kind of put some counter pressure and really focus down into their pelvis when they're pushing.
All right. And that's all you need to know about labor support.